Hello and welcome to our first Health Hangout on vitamin D.
Thanks, Vanessa. So, although vitamin D is called a vitamin, actually it's really a pro-hormone. Every cell in the body has got vitamin D receptors, and some of the foods that are sources of vitamin D are in decline. So, for example, oily fish, that's a really good source of vitamin D, but a survey showed that only about 27% of the UK population now consume oily fish. It's commonly thought that milk contains vitamin D, so just to rule out that myth, in the UK our milk isn't actually fortified, so we don't get vitamin D from our milk. However, some children's yogurts, fromage frais and cheese triangles are fortified, so they can be good sources. And other fortified foods include some soy milks, some soy yogurt and some nut milks, and there's also a buckwheat and poppy seed bread which has got 30% of the RDA of vitamin D in just 2 slices, and then fortified breakfast cereals as well.
Obviously we've got diet and dietary sources of vitamin D, and then the other area is through sunlight. And we've had loads of questions about this actually.
Make no vitamin D in areas of northern latitude, so that's the whole of the United Kingdom, and it's worse the further north you go. We make no vitamin D between the months of October to March because the zenith angle of the sun is of insufficient wavelength to allow those UVB rays to basically be strong enough. And so you start to run out of your stores in the winter, and you'll have your lowest vitamin D level in about March time, when you've come to the end of that storage.
But the area where there's perhaps the best evidence and the most well-known role is in bone health. And just as a little recap, basically vitamin D promotes calcium absorption in the gut and maintains serum calcium and phosphate concentrations to allow normal bone mineralization. It's also needed for bone growth and remodeling. So basically, if you have low levels or deficiency of vitamin D, this impairs your calcium absorption, and then it's related to bone diseases like osteoporosis and rickets.
Can you talk to us a little bit about which groups are at risk of deficiency in the UK?
And that showed that actually South Asian ladies were below 25 nanomoles per litre for literally the entirety of the year.
So that another group that has their own recommendations, which is quite close to my heart, is pregnant women and breastfeeding women and breastfed babies. I've got an 8-month-old child, so I've very, very recently been pregnant, and no healthcare professional that I came across throughout my pregnancy or after I'd given birth has mentioned to me about vitamin D supplementation.
All pregnant women should be taking a supplement of 10 micrograms a day.
What are your views on the paper of obesity causing low vitamin D levels?
There's been a lot of interest today, and it's been on BBC News, from the study that's been published in PLOS One from the UCL group with Alina Hipponen as senior author on that paper. And it's basically a Mendelian randomization analysis looking at very much around genetics and obesity and vitamin D.
We've heard all about vitamin D, what it is, where we get it from, how to balance sunlight exposure and risk of skin cancer, plus lots of vitamin D's role in bone health and other health issues, particularly pregnancy and breastfeeding and breastfed infants. So we hope you've enjoyed the Hangout, and hopefully we'll see you again soon, because we're going to do a monthly Hangout. So fantastic. So bye from all of us.
Bye.
Bye-bye.